Namaskar, I am Dr. Monu Singh, Senior Consultant Orthopaedic Surgeon and Chief of Services for Joint Replacement, Arthroscopy and Sports Medicine at Narayana Superspeciality Hospital, Gurugram and Dharamshila Narayana Superspeciality Hospital, New Delhi. Talking about the shoulder instability which happens after dislocation. Many a times we receive patients who have had dislocation of the shoulder which has been very satisfactorily reduced and the patients have become okay after that episode. But however, later on they come back to us with a feeling of instability, specifically in movements of overhead abduction. When the limb goes up and outwards, they may get a feeling that the shoulder is unstable and it is subluxating. So in these situations, what has really happened is when the joint has dislocated and the tissue which is forming a resistance against this dislocation, which is mainly the labrum of the joint. So that tissue has been disrupted, and following the reduction of the joint, that tissue has not healed in a satisfactory manner. Now, depending on how much the trauma was, what was the initial amount of injury, the tissue may not heal on its own in a natural manner, in a satisfactory way. In such cases, whenever the patient is bringing his limb outwards and upwards, as in a throwing position, they may suffer from a repeated dislocation of the shoulder or a subluxation. In these situations, the treatment nowadays is very simple and easy. We generally require an MRI scan of the shoulder to understand what all soft tissues are involved, where all the tear is present and which tissues have not healed properly. Once that is ascertained and outlined, the treatment is very simple by means of very small incision about 4-5 millimeters, through which we insert a camera inside the joint. We also put in our micro instruments. We are able to see the joint from inside, and we are able to find out where exactly that tear is, what are the tissues which are torn, which have not healed. And then we are able to repair those tissues back to the bone by means of very specialized implants, small anchors, which is similar to putting something on the wall to hang anything. So we are able to use those specific anchors which are put into the bone, and they are able to tie the torn tissues back to the bone. Once that is done, we are able to achieve a good control of the movement of the shoulder joint to prevent any further instability. And after a certain period of rest, immobilization, when we expect the tissue to unite, followed by simple physiotherapy and range of motion exercises, the patients are able to go back to their fully functional level and able to go back to their physical sporting activities, to heavy activities without any feeling of instability. Thank you.